Hi everyone. The purpose of this video is to talk about the compassion crisis, burnout, the measurable effects that using compassion can have on patients, and some techniques to efficiently introduce compassion into practice, specifically with IV placement. The idea of a compassion crisis refers to a phenomenon reported by patients and only appears to be getting worse in the U.S. healthcare system. This is common across all areas of healthcare. Essentially, there is a noticeable lack of compassion in interactions with healthcare workers. On the other side of the coin is the provider. Some of the hallmarks of the compassion crisis, from their point of view, are emotional exhaustion, lack of personal accomplishment, the economics of healthcare are becoming increasingly apparent. The expectation is more patients seen and provided services to in less time. It is vitally important, however, to not lose sight of the fact that the patient-provider relationship is not like other customer service interactions. It's much deeper than a simple transaction. So it is incumbent upon us as healthcare workers to find ways to respect this relationship and reflect on our own practice in order to find ways to efficiently incorporate empathic communication during our interactions with every patient, every time. These are some of the themes found in comments on patient surveys when asked about IV placement at Rush University Medical Center. Obviously, we are not intending to have patients' experiences be like this. Nevertheless, it is what is occurring. Fortunately, effective communication can mitigate many of these and make the ones that are sometimes unavoidable, like multiple attempts needed for a difficult IV stick, better or as good as they can be for patients. Ultimately, the preoperative period, that immediate period before surgery, can be, without exaggeration, one of the most vulnerable moments of people's lives. So, it is vital that we put some communication techniques in place, the same way we use techniques on actual IV insertion in order to make sure patients feel cared for and at ease. In a large survey, 87% of patients say that kind treatment by a healthcare worker is more important than wait time, travel distance, or cost. In this next section, we'll talk about the effects of compassion on patients, both physiological and psychological. We use lidocaine injections to numb up the area before we place the IV, and therefore lessen the pain with insertion. But believe it or not, we can actually get similar effects with just our voices and the way we talk to patients. Dr. Bhivanendran, the head of the anesthesia department at Rush, participated in some studies which examined the effect of courtesy during blood draws and how it related to perceived pain during that blood draw. It was found that just simple courtesy during blood draws was found to have an outsized effect and significantly reduce the pain that patients felt. Now, blood draws are not exactly IV placement, but it's a similar concept. I like to call this mitigation of pain the vocal local. Two medicines we give in the perioperative period as anesthesia providers are opioids and anxiolytics. One deals with pain, the other with anxiety, as the name suggests. Now, I mention this because several studies have found that compassion shown to patients can actually have physiological effects due to the release of endogenous opioids. The release of these endogenous opioids have modulating effects on pain transmission, and this is by your voice and your words alone. An additional study showed a 50% lower requirement for opioid pain medications following surgery in the experimental group who received enhanced compassion before surgery. In the same study at Massachusetts General mentioned earlier, it was found that empathic communication before surgery actually had a greater effect than sedating medicine to keep patients calm. Compassion is like a superpower. In this way, you're actually influencing their vital signs and stress response by your word alone. Even though we neatly divide the perioperative period into sections pre-op, intra-op, post-op, it is actually a continuum, and your compassionate actions before the procedure can have beneficial effects throughout the entire thing. Empathic communication is important because patients can tell if people care essentially immediately. The case study of Dr. Edward Viner, a physician who underwent a harrowing experience in the ICU, illustrates this point excellently. While he was on a ventilator, he said at each shift change, when a new nurse would come in, he could tell whether they cared within 1 minute. He credits those nurses who showed compassion and did care with giving him the psychological wherewithal and willpower to become strong enough to get off of the ventilator. Following this experience, he went on to form the Center for Humanism at Cooper Medical School at Rowan University. He's now devoted to figuring out how to infuse compassion training into medical education. Another example of the profound psychological effect that compassion can have is illustrated by the use of child life specialists in a variety of departments around the hospital. Their specialized training allows them to create an emotional connection with the child, putting them at ease in the acute moment and actually preventing the traumatic experience from setting up as long-term PTSD down the road. There is no magic medicine or expensive treatment. This is simply applying empathic communication techniques and addressing the concerns of the child. This leads to a myriad of realized benefits in the current moment and unrealized ones later down the road. A quote from Kenneth Schwartz sums up the effects of compassion succinctly. You may recognize this name as the founder of Schwartz Rounds. This is a national program in which healthcare workers meet and discuss the social, emotional, and ethical issues surrounding care. He said that compassion is not just nice to have, rather, it is imperative in healthcare and has the ability to make the unbearable bearable. All in all, increasing compassion increases the quality of what we are doing. In this next section of the video, we're going to talk about some techniques to improve compassionate communication. One of the barriers, especially in the preoperative area, is time. Everybody wants to be moving fast, efficient, etc. This idea of production pressure certainly plays a role in the development of the compassion crisis we mentioned before. There's a focus on the task at hand, and everything else falls to the wayside. But it does not have to be that way. In a randomized controlled trial, oncologists use a specific compassionate phrase in the experimental group when speaking with patients about a cancer diagnosis. Normal discussion was used in the control group. The result of using this phrase significantly reduced anxiety in the group who received the compassionate phrase. And as far as time went, this only took 40 seconds. 40 seconds for the provider to make a meaningful impression on the patient that made them feel like they were cared for. We can translate this to IV placement using a short preamble such as, I know this IV placement is going to be uncomfortable, but I will talk you through each step of the process and you can let me know if something doesn't feel right, so I may be able to adjust what I'm doing. In regards to time, one of the best strategies to make the most of it is being intentional with your actions and words. As healthcare workers, we should approach each interaction with the intention of compassion in the backs of our minds. The same way you approach putting in the IV, intentional about always cleaning with alcohol, intentional about finding a vein, intentional about the angle your needle goes in, and intentional about advancing the catheter. Sloppy technique won't get you the results you want in respect to the placement of the IV, which is a catheter in the vein. Ineffective or half-hearted use of compassion won't get you the result you want either, which in this case is a patient who feels at ease before surgery. Being intentional about compassion can change the effect you have on patients, as well as change the way you see your position within the perioperative team. Now, this seems obvious, but there is something a bit more concrete to it. This idea of intentionality has roots in neuroscience, specifically the concept of neuroplasticity. In a few other words, neuroplasticity is the brain's ability to change its structure and function, and can be applied to this situation. Repeated intentionality during your interactions with patients will actually change the wiring of your brain, making the aura of a compassionate, relaxed healthcare provider who can easily make patients feel comfortable second nature for you. Think of this as working out your compassion muscle or upgrading your operating system to one that gives you the special communication feature. We mentioned burnout earlier. This is a serious concern for patients, as well as for you. Turns out, the giver of compassion receives reciprocal positive emotions back, and this helps to build resilience. So when those difficult situations arise, you will be more adept at facing them. There's an inverse correlation between the use of compassion in your practice and provider burnout. This quote from the theologian Henry Nguyen sums it up very well. The joy that compassion brings is one of the best kept secrets of humanity. It is a secret known to only a very few people, a secret that has to be rediscovered over and over again. The use of compassion actually activates reward pathways in your brain. Instead of a runner's high, you get a helper's high. The READ model is a framework for communication by healthcare workers. This is a systematic way to effectively and efficiently communicate with patients in a meaningful and compassionate way. The model's acronym stands for relationship, establishment, development, and engagement. We'll discuss each component of these a bit further in this section of the video. Establishment and development are the first two components of the READ model. These pieces essentially occur at the same time. This is where that efficient use of time we mentioned earlier comes into play. Respect for the patient conveyed with the welcome is key. They are the most important member of the healthcare team, and they should know that they are valued. The welcome is the first part of the first impression and sets the tone for the encounter. These statements may seem obvious, but all these little aspects add up and form the final product, a compassionate encounter during which the patient feels listened to and cared for. When introducing yourself, place an emphasis on the role you play on the team. You guys are IV specialists. You're very, very good at IV placement. You are the ones we go to with the toughest sticks, and patients deserve to know they are in competent hands. Collaboratively set the agenda with the patient. Briefly explain the steps of the process and ask if everything sounds okay with them. There is an important consideration to include in the introduction that will ideally establish the fact that you care about the patient and their experience. Make sure to ask if they have any concerns or trouble with past IV placement. Validate and acknowledge any previous concerns. If they're IV related, you can address this in the best way you know how. If they're surgery and anesthesia related, assure them that the team will be in to speak with them. The SAVE acronym can be a helpful way to effectively fulfill the first part of the READ model. All four components of this acronym can be incorporated into one or two sentences even. The first part, support. We want to make sure that the patient knows we as the healthcare team are there for them today. Acknowledge, validate, and emotion naming are all very closely related. Essentially, we want to make sure that the patient knows that they are not alone in their feelings, and it is entirely okay to feel apprehensive or nervous. No one likes to get poked. Another thing to consider is showing patients who are apprehensive the IV supplies. You can attach it to your ID badge. Many people actually don't realize it's only a little piece of plastic, not an actual needle. So you've developed a clear and concise plan with the patient. Now carry it out. As best you can, assume a position that is comfortable for both you and the patient. Check in with them after you position. Let them know the things like the rubber band will only be temporary, things along those lines. Also, avoid painful language. Literature shows that speaking in context of pain actually increases painful feelings. This is tough to do. I know myself, I automatically reach for phrases like little pinch, little poke, etc. Consider simply counting down 1, 2, 3 without mention of pain. And then do the thing. Alright, did you successfully place the IV? Now transition to the next parts of care. Summarize what they can expect. Say, we're going to tape it up, make it look good, and make sure to ask them how it feels when you're all finished. Or were you unsuccessful with the placement? Which is okay, happens to all of us. Explain what the issue you ran into was. Don't blame the patient, but objectively explain what was difficult and how you're going to readjust. Briefly lay out those escalation steps. This is important. Make sure to acknowledge the patient's contribution to the process. You can say things along the lines of, "You did really well with that placement. I know it's not the most pleasant experience." Make sure that they know it's a collaborative effort. Patients like to feel engaged in their care. Make sure to ask a few open-ended questions as well, if they have any concerns about the IV or anything else that can be done for them. Before leaving, you can also give the patients an idea of what to expect next. You can say that anesthesia and the surgical teams will be by. Preoperative nurse will finish checking you in, so on and so forth. Explain that it will be busy, and it might feel a little overwhelming with the amount of people going in and out of the room. That's to be expected. There's lots of moving parts in this process. If you have any questions or need anything, you can let us know. These little pieces all seem obvious, but the sum of their parts is how we arrive at a great experience for patients and us.